What if Parkinson's is an accumulation, not a mystery? Hello, I am Dr. K. Paul Stoller, and that disease we call Parkinson's. Where did it come from? Did it just appear? Another random coincidence? Unavoidable happenstance? But what if that label is hiding something much more uncomfortable? What if Parkinson's isn't one disease, but the end result of years of accumulated damage? Look at the exposures linked to it: pesticides, head trauma, manganese overload, and/or industrial chemicals. Different sources, same biological signature: mitochondrial dysfunction, oxidative stress, inflammation, loss of dopamine neurons. That's not coincidence, that's a pattern. Now add another layer most people ignore: mycotoxins, compounds produced by mold, including one called ochratoxin A, shown in lab and animal studies to disrupt mitochondria, impair protein handling, damage dopamine systems, trigger neuroinflammation, the same pathway again. So stop for a second. How many different causes have to hit the same pathway before we admit we're not looking at separate problems? Now here's where it gets even more uncomfortable. Some patients with Parkinson's symptoms show improvement with hyperbaric oxygen therapy. Now why would that be? HBOT doesn't care what caused the damage. It targets oxygen delivery, mitochondrial function, inflammation, neuroplasticity. In other words, it supports the system that's failing. If the system can improve, then what does that tell you? That this isn't just irreversible decline, that there's functional impairment in play. And if that's true, then we've been asking the wrong question. Instead of asking, what's damaging the brain? We focused on, how do we manage the symptoms? Instead of, can we restore function? We've settled for, can we slow the decline? That's not progress, that's containment. And the cost? Entire categories of contributing factors, be they environmental or metabolic, get sidelined because they don't fit a neat narrative. Parkinson's may not be one disease. It may be what happens when the brain's energy system is pushed past its limit. And if that's true, then the real question isn't just how we treat it, it's how much of it we've been willing to ignore. Parkinson's disease is often framed as genetic or age-related, but emerging research suggests multiple environmental and metabolic stressors may converge on the same biological pathways. From pesticides to head trauma to mycotoxins like ochratoxin A, the pattern raises a difficult question. Are we dealing with a single disease or cumulative damage? And if therapies like HBOT can improve function, Tin, what does that say about how we're approaching treatment?